Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com.
Aloha Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Well, hello there. Thank you so much for joining us. You know, we come at you weekly and we talk about all kinds of things and what you can expect as far as treatment for venous disease. And we talk with Dr. Juliff all the time. And every now and again, we break the mold and we actually have the opportunity to talk with a patient. And and we're talking about patients at all different levels. And that's what you're going to meet today. Her name is Andrea, and we're going to talk a little bit about her. And I think it actually shows, Doc, if for no other reason, the wide variety of folks that you have. I mean, you know, it's and today it's going to be great because here we got somebody that's not from here but ended up here like most of us, and now is being treated. So let's talk a little bit about our friend Andrea.
Okay. Andrea, I think probably displays a number of important features about venous insufficiency when we're looking at people, evaluating them, and then also for the patient to kind of be aware of the potential for them to have vein problems, and many people don't recognize the signs and the symptoms. Some of them are not necessarily, easily connected to a vein issue. I mean, I think people with varicose veins, that's a pretty easy step. If somebody has varicose veins, it's easy for them to say, gee, I've got a vein problem. Mm-hmm. But Andrea had a couple of other things that were probably unusual, especially for her age group. She's on the younger side, although we treat people. Andrea's 27, and we treat people in their 20s all the time. We've treated people as young as 16, 17. So it's really an equal opportunity.
It's not all old geezers like me.
Right, yeah.
But I think it's sort of interesting. And Andrea, welcome.
Thank you.
I don't want people to think we're talking behind your back. You're right here. We know what you're talking about. You have when we met just a little bit ago off the air. You have a lovely accent. Where are you from?
Thank you. I'm from Macedonia.
Macedonia,
in Europe.
Wow, yeah. And I mean, that's kind of far away from here, isn't it?
Yes.
What did you know about Hawaii as a little girl in Macedonia? Did you think it was like palm trees and little grass shacks?
Yes, paradise on earth.
Yeah. So how did you end up here? What brought you to Hawaii?
A very dear friend of mine invited me over here on vacation, and I just stayed.
Isn't that neat, Doc? And
yeah.
In some respects, Dr. Juliff, you run all over the place. It's sort of the way a lot of folks end up here, and also it shows you what an interesting place this is. And Andrea, we've talked about this before. Really need to be in Doc's position because he sees all ethnicities, all age groups, and everybody in Hawaii because we're the melting pot of patients.
Mm-hmm. Yeah, it's so multicultural here, and which is very cool. But yeah, it gives you a good idea about how universal venous insufficiency is, and it gives us a good opportunity to see how various people respond. To treatment and, what it was that kind of got them to the point that they're at.
Okay, and we're not going to play hide and go seek. We're going to get right to the crux of the matter here. At what point in your life did you know that you had issues? What sort of symptoms or what sort of things came up to make you think about, gee, I better go have somebody help me with this?
Well, I knew that my grandma from my mother's side and from my father's side, they both had varicose veins. Mm-hmm. Also, a few of my aunts had varicose veins and spider veins.
Okay.
And I know the issues my grandma has been going through, so I was hoping that I won't get that too, but I started experiencing pain, swelling in my ankles, especially, and my feet.
By the way, this isn't TV, so you can't see Andrea. Totally, normal in every respect. Height and weight, everything's in balance. This is not somebody that necessarily had ankle or foot problems because you were too big or because in other words, this is you. You're quote very normal. So you must have thought, what is this? I'm normal. What is this going on here?
Yes, and honestly, I was tired of feeling the pain and the heaviness in my leg. So when I came here to Hawaii, I looked up the vein clinic, and I had no idea anything about them. I just looked them up, and they had amazing reviews. So I thought I would give them a try.
Everybody, go ahead and yelp away. We like that.
No, really.
Andrea, what you mentioned your grandmother and the problems that she has been or is having. And you didn't want to go down that route.
Yes.
What is going on with your grandmother right now?
Well, she never got treatment.
Yeah, she was never treated.
Yes, she was never treated. So, you know how it gets worse and worse with age.
You're right. Thank you.
The varicose veins. So I didn't want to go through that.
But what specifically have you seen your grandmother's legs recently? I mean, describe her legs to us.
I had the varicose veins before my RFA. Yes, both of her
legs. A lot
legs
of varicose veins.
Yes.
Does she have
spider veins as well?
Does she have swelling?
Yes.
The way you had? And what about any discoloration of the skin in the lower leg? Brownish discoloration,
on
that
her
kind
leg,
of thing?
Yes, I remember.
So, and that's that's a sign of further advancement of the whole process, and that's what you don't want to get to is the point at which you're starting to have skin changes. But I think Mike, the first interesting thing about Andrea is that she has obviously a very strong family history. Both grandmothers. And then you said 5 aunts. So you're getting that genetic influence from both sides of your family. And like we've talked about in the past, if one parent has venous insufficiency and vein problems, it's about a 50-60% chance that you're going to. 1 out of every 2 persons will. If you have both parents or both families that are giving you that genetic influence, it's almost a foregone conclusion that you, unfortunately, that you're going to have it, because it's up around 80-90%. So you're in that category, and even though I think you had a strong genetic influence. You have worked in industries where you've been on your feet a lot,
yes.
And those are the 2 main things I think that have led to you developing venous insufficiency and varicose veins at a relatively young age.
Yeah, that's what I was going to ask, because I do know that you can have all of the predispositions and all of that, but if you further impact the probability by a career choice or by doing what you're doing, did it get to a point, even though you're a young lady, did it get to a point where it was actually preventing you from working? Did it ever the symptoms get so bad that you couldn't stand up?
Most of the time, yes, in the mornings.
Yeah, wow.
Right when I would wake up, have my breakfast, and then I would have to start moving because my legs would just swell.
Wow.
If you started moving, meaning walking around and stuff, then you wouldn't have the symptoms, and you wouldn't have the swelling. Which is also kind of a neat observation.
Makes you want to think about, is exercise important? Yes.
Is it important? It is. Unfortunately, exercise is not going to correct the problem. However, it will make the symptoms better, and the reason that happens is because being up and around, walking, running, jogging, etc., we're using the muscles of our legs, and the muscles of our legs, especially the calf muscle, is a very important part of blood moving through veins. You
got no other pump, right?
Right, exactly. We've talked about the fact that blood through arteries moves because the heart is pumping. Not so much for veins.
And it's also going downhill.
Well, yeah, it's also gone downhill. But, not so much for veins. We don't have thousands of little hearts all over the lower part. And so it relies on two things, these one-way valves, these many one-way valves that we have in the veins, and then also muscular contraction that, forces the blood to be moved, and hopefully the valves are in place, and it keeps it moving in the right direction. So
okay, so Andrea, you had a good Yelp review or two. You saw the reviews, you saw the website, and by the way, that website, for those of you that haven't done it yet, it's veinclinicsofhawaii.com. veinclinicsofhawaii.com, and particularly now you can click on the podcast, including this one. We like to do that particularly when we get the opportunity, and this is why, Andre, it's so nice to be able to see you, because we talk in broad strokes of the brush about all venous disease, but when we talk to a patient,
yes.
What specific problem, or which part of varicose veins or venous insufficiency did she have? Maybe you can talk about that with her.
Well, we've talked about the staging system for venous insufficiency, and the clinical classification is 1 through 6. 1 being the least, which is just spider veins and mainly cosmetic kind of things. 2 is varicose veins, so you had that, and then class number C, number 3 is swelling. So you're really within the clinical classification, you're a 3. Luckily, you haven't gotten to the 4 like we talked about.
Yes.
When we start to see the skin changes, that's a stage 4, and you don't want to go there. The worst stage is 6, and that's when you start to develop a chronic ulceration, and that's like down the road. But you definitely don't want to get there. But yeah, Andrea would be a C3.
Well, I think maybe, and that's why I'm way past that. However, it's never too late. So what I think people need to know is maybe some of it was cosmetic, but you certainly had symptoms, and so that's what drove you there. Did you also realize? Were you concerned at all about aesthetics, about the way anything looked?
Honestly, not so much.
Yeah. I almost, what, Doc? I actually felt that, by even talking, because obviously, if that were the only reason, you'd never, it just patients wouldn't come in.
Yeah.
But now but it had that other benefit, right?
Yes.
So you must think, hey, these legs look pretty good now. That's like we all do, right? So what sort of diagnosis did you do? And then let's explain a little bit and have Andrea explain the treatment that she's had so far.
Yeah. Well, we saw her in the office, obviously, in the initial consultation. And the next thing that we do with most people is to do an ultrasound. We use ultrasound pretty extensively for diagnosis as well as, following people after we've treated them. But what do you remember about the ultrasound, and how was that?
I had my first ultrasound done in July of last year.
Yeah.
And I remember Mike. Yes.
Was it cool being able to see inside?
Yes,
I love
very
that.
cool, very cool.
So
yes, and he was explaining to me that the red parts are where the vein is not closed.
Well, the red part was those portions, those veins that were not functioning properly.
Yes.
That red color indicates that the blood is moving in the wrong direction. So, that's the key thing that we look at with the ultrasound machine. Yeah, and it's a really cool device. And ultrasound machines, they just kind of keep getting better and better with each model that comes out. I know that Mike likes to show people what he's seeing, and it's fun for the patient too.
I really enjoy it too. I've had I've had the opportunity to work with Mike on a couple of things, and he's like Mr. Fact Finder, right? He knows what he's looking for.
Yeah,
he's
exactly.
multitasking. He's using both hands. This guy's really,
right.
But I felt that I was being included in the diagnosis and included in the treatment, which was important for me.
Yes.
Yeah, it makes so much more sense. I mean, we can talk all day about, valves failing and blood going in the wrong direction, but when you can really see it happening inside your own body, it really kind of brings the process home and then makes everything else so much more, rational to the patient, and they understand things, which is good.
Here's what I like. Now, you said, so that was your first ultrasound.
Yes.
Okay, and then you had treatment after that.
Yes, I had the RFA, the radio frequency ablation, the 4 main veins.
Mm-hmm.
Yeah.
Yes, in December, the end of December.
Okay, now here's what I like. What about your follow-up ultrasound when you could see what used to be and what you didn't? Was that helpful?
Yes, it was.
Yeah.
It was very successful, which I'm happy about.
Yeah, and
For the same reason.
There's no kid in that machine, is there? I mean, you know, you got to. And by the way, Doc, it's way more. And we get an opportunity to, brag on some of the folks working in vein clinics of Hawaii.com. That it's one thing to have an ultrasound, technician, and then one like you have, or people like you have, because they're really great. Yeah, they take such pride in their work.
Right. Well, with respect to ultrasound techs. They've done somebody like our ultrasound tech Mike. He's done additional education as well as he's got so much more experience than just the typical ultrasound tech that you might see in the hospital. Yeah. Because and even vascular techs in general don't really have the extensive experience that we need for people to have when they're starting to do venous insufficiency ultrasounds. Because there are nuances to identifying venous insufficiency, and like you said, he has to be a fact finder, and sometimes on first glance it may not be obvious, but you have to kind of work little tricks to kind of show if there's a problem. So it takes a special kind of experience and mindset to be a good vascular ultrasound tech, especially venous.
Do you use the technology while you're performing procedures?
We do,
that's pretty
all
cool.
the time.
Yeah.
And even when we're doing the procedures, I kind of like to show the patient what's happening, and because you can see not only the vein, but the catheters and the devices that we're putting into the vein, which is interesting. So it's a good tool. Well, it's a necessary tool. I mean, we absolutely need.
It used to be nice to have. Now it's kind of must have. Isn't it?
And then the benefit of of showing the patient and them being able to enjoy the procedure too.
Well, that's the other thing of it. I mean, I love Andrea to have the opportunity. First of all, I've had the opportunity in the waiting room to talk to a lot of patients, men and women, and I find out that some of them that are there strictly for cosmetics, they really get interested in somebody else. I mean, what you were not worried about the cosmetic part at all.
Honestly, not at all.
Which I think is, that's really refreshing, Doc.
Yeah, well, that is good.
Look. Us men were, the alpha males. We don't care about these things, but we do, and but it doesn't seem like you had any of the big, lumpy, bulky, big ones things.
Well, Andrea did have some varicose veins. Yeah, she definitely did. Probably enough that it would annoy some people. Yeah. That's for sure. But I think Andrea's personality just is such that that wasn't the feature. Now, most people with varicose veins are going to have some symptoms. I mean, even though many people kind of, maybe don't recognize it, like we've talked about before, the symptoms of venous insufficiency, they come on over such a long period of time and so slowly that a lot of people sort of aren't aware of how bad their legs are feeling, especially with respect to the fatigue and heaviness. But you probably saw some dilated veins, varicose veins, before you started to have the symptoms that really brought you into for evaluation. Would you say that's true?
Yes, that's true.
How old were you when you first saw varicose veins?
Do you think?
I was 22, 3.
Okay, so 4 or 5 years ago.
Yes.
Incidentally, when you mentioned earlier, for those that are just joining us, Andrea talked about symptoms, and it sounded like you had multiple symptoms, not just one, not just heaviness. What were they?
Heaviness, fatigue, swelling.
Yeah.
Also swelling in my feet, like going up to my toes.
Yeah, was it ever to a point where you had difficulty putting on a pair of shoes that fit you?
Yes,
yeah,
yes,
then it
yes.
Yeah. That's a big, Doc, I think that's a big deal. Yeah. Because I do know that, what happens every now and again, and we'll talk about the lovely compression hose and
Stocking.
the
Sure.
stockings because
Yes.
I've
Yeah.
got mine on. But
Well,
it's
so does
interesting.
Andrea. Yeah, she's got her on.
Well, okay, but I'm kind of tricky because I'm going to do this. You see now, wait. What I'm showing them is this. See, that's black, but they didn't have black ones, so I have these underneath it.
Oh.
But I didn't want to have that color. but I'm also doing that, and bear witness, that I'm showing Doc that I'm actually really wearing it.
Yeah, thank you, Mike. That makes me feel
But you
good.
know, the reason I asked that is because I had an experience once years ago where I do a lot of traveling, and I took my shoes off, and at the end of the trip, I couldn't get my shoes back on. I had to walk through the airport barefoot with my shoes in my hand.
Yeah.
And it's not close. It's like these aren't even my shoes.
Yeah.
But what causes that, Doc?
Well, I was just going to say, even though that's it's comical, but
not when it happens.
We're laughing at it now, but that specific scenario we hear all the time, and because I think that people start to have swelling, and then that also is kind of just getting worse and worse with time, but. One of those situations where where it's really going to develop is if you're sitting on an airplane, especially if it's a very long airplane ride, and then over the course of that time your legs are down, you're never really laying flat, and the swelling starts and it just gets worse and worse. And if it's in a 6 or 8 hour plane ride, people can have a substantial amount of swelling, and that is often the thing that happens that then brings the patient in to see us.
Sure.
That's the thing that prompts them.
That's where I'm going because Andrea, by choice, your field of employment you're on you're upright.
Yes.
So one symptom was swelling. What else?
Burning sensation. Did you feel that as well?
Oh yeah.
Yeah.
Well, some people say burning, tingling, achy, but I had burning.
Where was that? Where did you feel the burning?
In my feet.
In your feet. Okay.
Yes.
What about muscle cramping?
Oh yes.
Was that you were having the muscle cramping at night?
At night, also sometimes when I was even working out.
Okay. And have you noticed that has resolved to some extent?
Yes.
Good.
For sure.
Good.
Yeah.
good,
And when you say working out, was there ever anything that you couldn't do because of either you were swollen or painful or it didn't feel good doing anything?
Yes, I would say when I would run on the treadmill.
Mm-hmm. Really, huh? Yeah.
Yes.
So, the muscle cramping as a symptom of venous insufficiency is one of those, symptoms that, obviously most lay people are not going to connect that with, vein problems. And especially in our older patients, we see so much muscle cramping, particularly at night, and it really disrupts their sleep patterns. They have to get up and walk around, and sometimes it's difficult to get the cramping to resolve. And it's a huge difference between if you're 27 and you have a muscle cramp in the middle of the night, you stretch a little bit and it'll go away. Or you're compared to you're 87.
Yeah.
Yes.
When you're 87, it's a chore to get up in the middle of the night
I wanna
to walk
tell you,
around.
It doesn't have to be 87. I mean, I've had sometimes when I think no matter what I do, I couldn't get the pain to stop.
Yeah.
And it was like it almost gives you a panic attack because you think, hey, wait a minute, I this can't be happening. I don't want this to happen.
Sure.
And then some little move that you make, things work out.
Yeah.
But however, I think that what had happened is, have you noticed any decrease in any of these symptoms since you got treatment?
Yes, my recovery time is over, so I feel better. Like in the mornings, I don't feel swelling or anything like that, or pain in my legs anymore.
That's a home run right there.
Yeah.
Yes.
And that kind of indicates that, we've talked about other things causing swelling, for instance, and swelling sometimes is a hard thing to predict with respect to how somebody will ultimately respond.
Yes.
And how completely they will respond, because there are other things that cause swelling, especially in people who are a little older. But with you, luckily, the swelling was primarily and probably fully due to venous insufficiency, and you've had a good response, so that's great.
Yes, and I'm happy that the ultrasound was successful.
Yes.
Yeah, and that being said, have you shared this? I mean, first of all, Andrea is with us. If you're just joining us and figure out where does that delightful accent come from, she's from Macedonia, and like many of us, came to Hawaii and said, "This is it." She was invited to come over, and yet in your profession, you were in the food business, but you were standing up.
Yes.
And I asked you this before, but I want people to understand: was it ever so bad at work that you said, "I got to go take a break," or "I got to go sit down, I can't stand up"? Did it ever hurt that bad?
It did and it did not at the same time. But me being manic all the time and having so much energy, it kind of made me just work even more and harder.
Well, what we're talking about most of the time, with every time we have a chance to talk with a patient, is it's one thing to be getting something treated and eliminate the possible, serious complication, but it's all about lifestyle and enjoyment of life.
Sure.
If all you can get out of it is, now I enjoy walking around the park at night instead of limping around the park at night, that's another benefit.
Oh, yeah, absolutely. That's the goal. I mean, we want to eliminate the symptoms that are interfering with their quality of life, and kind of getting back to symptoms. We hear this all the time. People come in and they say, "Yeah, well, I have a little achiness, and my legs probably get tired quicker than they used to." But like I said, the symptoms come on over such a long period of time. You kind of accommodate for that, and we hear all the time. People come back after we've treated them and they say, "Gee, I didn't really recognize how bad my legs were feeling, or how tired my legs were feeling, or heavy, because now they feel great. They feel light, and I have energy, and it kind of affects the energy level of your whole body. If you're really kind of having difficulty walking around, it can kind of depress all of your energy, not just your legs."
Yeah, and Andrea, earlier we said that we love it when we have the opportunity to talk with the patient, because a lot of times somebody's had venous insufficiency for 20, 30, 40 years, and we've had a lot of some serious seniors in here, and even though it's terrific, the fact that they understand and are, it sounds like you got pretty proactive. So what it did was, you said you went online, you Googled, you searched, you found vein clinics, and you saw some good reviews. But what was it when you finally decided, okay, I like this, I'm going to go see him? Walk me through your first exposure there, your first visit. What was it like?
Well, it was the impression that I got when I got there. I spoke with Dr. Rebecca at first. I had the ultrasound done, and I spoke with her, and she told me all about, she explained to me the whole process of the procedures, what we have to do, what we should do, for me to start feeling better. I felt, honestly, when I went to the clinic, I felt like at home. They're very wonderful, and they make sure the patient feels like home. And I'm happy that they explain everything to you, and you're kind of in the loop of the things then.
Yeah, because, Doc, I think maybe what people understand is, once they've been diagnosed, when you lay out a treatment options, sometimes you can do a whole bunch in one day. Sometimes they have to come back a little bit of time. What was your recollection as far as when you first found out that Andrea was a patient and was going to have procedures done? Yeah.
Well, always the first thing is, we need to make sure that we've treated the patient with, or conservatively. Now, had you been in compression stockings before you came to see us, or did we have to go through that prior to treating you?
I did buy them about 2 years ago, but I only wore them for a few months.
Yeah, so, one of the things is that, and this is what people should keep in mind, if they're contemplating coming in, is that there is a period of time, and this is an insurance mandate, but there is a period of time during which we have to treat the patient conservatively. And typically that's with compression stockings and walking exercises, etc. But now do compression stockings do a great job? They definitely make your legs feel better. There's no question about that. But do compression stockings fix the problem? No, they don't. So it's kind of like a Band-Aid. the problem in venous insufficiency is it's a mechanical problem, and it requires a mechanical kind of fix. But
wait a minute. I have a question.
Yeah.
Because I wear mine every day. When do you put them on? How long do you wear them?
During the day.
Yeah.
Yes, and then I take them off at night. But during recovery time, you should wear them for a whole week.
Yeah.
Right. After procedures, our usual protocol is about a week of stocking use that we definitely want the patient to use. Then thereafter, it's kind of optional. But have you continued to wear compressions? Yes. Okay, good.
Yeah, we've actually, Andrea and I are in the club because I wear mine every day. And it's been months since I've had a procedure. But I can tell you that, I find that I leave them on longer. I mean, my deal is my normal regular morning show is I wake up at 3:30 during the week, and by 4 o'clock my stockings are on, my hose is on, and I don't take them off until 9 or 10 o'clock that night. I can tell you that it actually does have a direct correlation on how much you can do and how much energy you have.
Oh, yeah. Yeah,
and
definitely.
To me, that's worth the price of admission, just that. But in actual fact, I don't know about you, Andrea, but I'm kind of a little bit disappointed that it won't cure anything. But it just, but it makes you feel good. So in some respects, it is curing. Yes. I can do more things. You said that you had issues when, for instance, if you're at do you have a treadmill at home or do you go to a place?
Yes, a gym, but also I play tennis.
Yeah,
so the other day I tried playing tennis without my stockings on, and it felt weird.
See, that's what I was trying to get at on a different show, because I do know that more and more young people, which you are one, now they're nice ones, they're cute ones. You can get colored ones and all this stuff. But the bottom line is, if athletes are using them that don't have, venous disease, this is a good idea.
Yeah. There's probably a couple of different things going on there. Andrea is still pretty close to her procedures. It's just been a month or so. So she still, I think, is in the process of going through that healing period. So I think, and a lot of people will say, gee, when I was healing after the procedures, it was more comfortable to have that, compression on, and gives you a little more self-assurance or whatever. But so there's that. But then what you were alluding to, Mike, is that that compression does help in athletic activity.
Yes.
And the thing that they have talked about here recently is how compression, especially in the area of the calf, is going to benefit muscle recovery after high intensity activities. And it has to do with clearing of the toxic kind of materials that are generated when you use your muscle a lot. But a couple of different things going on there.
Andrea, do you use the open toe or the closed toe?
The open toe.
Yeah, me too. See, yes. I like it. But then also, I've developed a couple of tricks to put them on. Do you use any of the devices, or do you just put them on by yourself?
By myself. I think I mastered it by now.
Yeah. It is, and it's a lot easier.
Yeah.
And Doc, we discussed this not too long ago. Once you've done it, you think, geez, I don't know why I balked and resisted this for so long. It's pretty easy.
Yeah. There are tricks. Mike, you've developed a trick.
I got a trick.
And and you do it very, very well. We need to make a YouTube video of it. Yeah. And everybody has their little tricks. We've got in the office, we have a cool little device that
I love that thing. That rolling
thing.
Yeah.
Me too. The rolling thing
rolls the patient, rolls the stocking onto the patient.
That's particularly good for that. I don't know about you, Andrea, but when after a while ago when I had a procedure, I wore the thigh ones for a couple of weeks. I didn't like them because they wouldn't stay up. But I found out that they are really important to put on with that thing.
Well, definitely.
Somebody invented. That's a great invention.
Yeah, I wish I would have.
Yeah, me too.
But you're still wearing your thigh-high stockings, right?
Yes.
So Andrea's still in that period of time. But I think that once you have the tricks and once it becomes routine, I tell all of our patients, even after they've gone through treatment and they're all done with that, for long-term, day-to-day use, getting a good quality knee-high stocking and wearing even if you wear it just while you're at work, especially if you're someone who works on their feet. And if you do that, you're going to benefit from it over a long period of time, especially someone like you, Andrea, who is young. You're 27. You got your whole life in front of you, and you're going to be, I'm sorry to have to tell you this, you're going to be working for many, many years. But
there's no magic bullet for that yet. But interestingly enough, wouldn't that encourage you to be even more aggressive at work? I don't know, if that's a concern, but I would imagine that sometimes people would actually make a career change based on being uncomfortable at doing something. Like we talk, Doc, a lot of times when somebody's a hairdresser or a dentist or that are standing up all day long. People that don't stand up, they don't understand how stressful that can be.
Yes. Right. Yeah, and especially those people who are on their feet all day long and standing in one position. Like you just mentioned, hairdressers, dentists, pharmacists, those kind of people, but also
front desk.
Front desk, but everybody in retail, a lot of times people are working in stores, and they're moving around a little bit, but if the store is small, it's not like they're moving around a lot. So for all intents and purposes, they're just in the same position all day long, and that's the worst.
I got to tell you, and Andrea, you probably relate to this. Is I have a friend whose wife works for the city. And she works in the in the automobile licensing area. And people are not happy when they're there. They're there in their long lines, and she's standing up all day. And when a customer is finished, she has to get the next customer. And they're all coming in, and they're all yelling. And sometimes she just tells her boss, I got to go sit down. My legs are killing me. But that adds to the stress, doesn't it? So even though it's been relatively a short period of time, do you have it's been a relief, or what sort of feeling is it that you made the right decision about getting treated?
Oh, yes, relief for sure. And I wanted to do at a younger age, so I don't have to worry having more varicose veins in the future, or even spider veins.
Right. And hopefully all of that will be diminished. Now, since you have, and this is what I tell everybody, since you have a fairly strong genetic component to your venous insufficiency, might you have other issues come up in the future? Well, you might. Again, you've got many, many years still to live. So things come up. But what we normally like to do is we like to do periodically, surveillance ultrasound. So we do a couple very close to after your procedures and stuff. But thereafter, then every 6 to 12 months, we'll be reminding you to come in for an ultrasound. And typically, and if we do that, consistently, then usually we can see things coming up at an early stage, do something minimal, and so it's a little easier to take care of, and it will stop that progression of worse things happening in the future.
Yeah, do you have a chance to talk to friends that may be also feeling not happy about the way they feel? I mean, have you been willing to share what you're doing?
Yes, I shared my experience with many friends in the mainland, back home in Europe. Yes, and also my aunt who lives in England right now, she had the procedures done. She used to live in Sweden and now in England. And I told her I'm going to do them here. And I shared, about the Vein Clinic of Hawaii.
But, Doc, talk about, weren't some of the garments. And it's a shame when you look at the socks that they're not socks. It's a medical garment that you're wearing, right? And so they're not cheap. You have to take care of them. I know. I've washed a few holes in them already. But didn't they get originally? Aren't they? Isn't Germany where they were? Developed.
Yeah, I think it was a German. I don't know, physician or something. But they originated in Germany. Yeah. They're it's a high tech garment. There's no question about that. I mean, we call them graduated compression stockings because there's the most compression is down around your feet and ankles, and then the compression kind of lessens as it comes up the leg, and that they found apparently that helps with blood flow making it progress up the leg, which is the way we want it to go.
Yeah, I'm kind of proud of you, Andrea, now that we've learned a little bit, that you're so aggressively looking for help and seeking it. And then once you find it, and not only sharing it, but does it help you for goal setting? I mean, what do you think is next for you? Where are you with this in your own mind?
Well, I hope that I don't have to do my next procedures in like average of 8 to 10 years.
Yeah. But by the way,
oh boy,
it's true.
You're putting a lot of pressure on us, Andrea.
But one of the things you did say, Andrea, and I learned this through the ultrasound, through Mike, the technician, that, some things, it's just that you make a little note to the file to keep an eye on.
Yes.
It's not saying, and I didn't feel at any time any pressure into having anything done. But did you have the same thing to say, okay, if that's that there, what's going to happen to this? Is it going to change? Is it going to get worse? When do I get it fixed?
Well, yes, under my knee on my right leg, I had the vein looked like a bruise. I don't know if you remember. It looked like a bruise, and it bothered me.
Right.
And people would think it's a bruise, but it's actually like the vein.
The little cluster of veins.
Cluster,
yeah.
Yes.
I had one of those too. It was about that. It was a big around like a Coke bottle on the bottom.
Yeah, yeah.
And it looked like it was. Can that be from trauma, or is that a
yes?
What is that?
Yeah, well, trauma sometimes can be the inciting event. I mean, we hear that a lot. Where people will come in and say, "Yeah, gee, I got hit by a soccer ball or whatever," and it's hard to know because these things will pop up spontaneously, also just by virtue of the fact that venous insufficiency is happening in that extremity. So it's hard to know exactly, but I think did we inject that or did we were we able to? Yeah, so. Most of those things respond to what we call injection sclerotherapy, and it closes the vein down and it makes it disappear.
That's also, Andre, what I had. As a matter of fact, I'd had that thing for decades, and now I can't even see where it was, and so that's a big improvement. So this thing, how long had you had that, do you think?
Oh, I remember I had it since high school.
Wow.
So like about 10 years yes.
And so from the time then when you had it treated, did it slowly fade away? How long did it take to go away?
Well, I just had it treated 2 days ago.
Oh, This is great. Okay, we got to get. Okay, Doc. What we need to do is we got to get
a follow-up.
Yeah.
You got to do a follow-up.
Well, we may or may not do a follow-up depending on the result.
No, but what I'm saying is that this is a great before and after.
Sure,
because you just had that thing.
Yeah.
So and with the camera phones now that we have, we can take a picture of that anytime.
Yeah.
But I think that the other side of the thing that I wanted to make sure that you could share, Andrea, is that you already told me about the level of professionalism and how the office was. I also found it to be a fun place. Even though everybody's there for some sort of illness, I don't see anybody grumpy. Everybody's looking for to get help there.
Yes, that's what I said. I felt like being at home with them because they're fun and they help each other and they look like they're like a family.
Yeah. Well, we try to keep the place inviting, but the difference between what we do and for instance in my past life when I was doing heart surgery and bigger vascular surgery. Those patients needed to come to us, and they needed to have heart surgery, et cetera, et cetera. Most people that come into our office probably feel like they need to do it, but it's more of the patient's decision. Getting to the point where they're saying, "Gee, these symptoms have bothered me long enough. I got to do something about it." As opposed to like another doctor saying you must go over here and have this done. So it's a little bit different mindset, but I think we try to keep things positive and inviting, and I think that is gets reflected in how the patients do and how they progress through the system.
Well, so I'm thinking of Grandma because you told me about Grandma, and Grandma has not done any procedures. She's just lived with this stuff, right?
Yes.
Do you think she'd be tempted? Say, hey, what did you do? Have you told her?
Yes, but she's in her late 70s, so
Age is not a contraindication.
I know I should bring her here.
Yeah, yeah.
24-hour flight.
Have her come on over. Yeah.
Well, I can tell you one thing that it is, unfortunately, this is a disease that sneaks up on you over decades. I mean, every now and again, and we just talked about somebody off the air prior to you getting here, was somebody that had a deep vein thrombosis, a DVT, and they died because it happened on a flight. When they got to the other end, something happened and the person died. So it's not anything to be trifled with, is it? Once you start looking at something cosmetically, that's one thing.
Yeah.
But you start looking at everything else.
Well, and that's one of the hurdles that we have to always fight with, because a lot of people feel like it is just a cosmetic problem. I mean, even when they have a medical issue, they have medical the level of their venous insufficiency is medically necessary to be treated. Even a lot of those people are either think in their mind or are being told by other people that oh, that's just cosmetic, you don't have to worry about it. But yeah, it can lead to two things. Number one, you'll never, if you don't treat it, you're not going to get rid of the symptoms.
Yes.
Number two, if you don't treat it, then it will definitely get worse with time, just like your grandmother, and can go, progress to like we talked about, skin problems, ulceration, all those things that are, really things that you don't want to have to deal with. And then, there are other secondary complications that can arise in people with venous insufficiency. They are at a greater risk of developing a DVT, and DVT is something that people die from all the time. I mean, it's a very common event.
But the other side of it, though, Andrea, because you've done a lot of travel, you come from a way different part of the earth, and you're more used to it. Would that, do you think, have made you not want to travel? Were you ever worried that, hey, this might get serious?
Yes, because of longer flights. Like flight back home would be about 22 hours with layovers. But
well,
still.
when in younger years, the pilot would come on after the plane took off and say, "Oh, this is your pilot. We're doing this. We're doing that. Feel free to walk around the cabin." They don't tell you that anymore, do they?
But I always had to walk around because I couldn't stand just sitting still because of the pain.
Yeah.
Oh, but what's interesting, Doc, is she has this energy to be athletic, to be on the treadmill and all this stuff, and fighting through the pain. I mean, so that must mean that some of these things that you did before that were painful are not so painful?
Yes. Swimming always helps.
Oh, is that good? Good for you, yeah.
I was raised by a lake, so I swim a lot. And here it's the best.
I love, I too, because you're weightless, and so you can do a lot of things. But Doc, I think that when we have this opportunity, like we have had with Andrea today, it lets everybody know that your patient swing of the metronome it's back and forth. It's from somebody in her late 20s to somebody in their late teens to somebody in their late 80s.
Yeah. We have a very broad spectrum of patients, and venous disease is definitely a non-discriminatory type process. I mean, it affects everybody, and but luckily we can. The reason that we can treat so many different people is because of the new processes that we have, the new devices that are so minimally invasive. And for a procedure that used to be done in the hospital under a general anesthetic, and the patient would be in the hospital 2 or 3 days, that has been replaced by a procedure that we do through little needle puncture sites in the skin. And,
like I say, walk in, walk out.
It takes 30, 45 minutes, and then the patient leaves the office and literally goes on with their day.
Let's remind everybody, Andrea, you're a relatively new patient, started in the middle of last year, and just had one procedure. When?
4 procedures.
Yeah,
the end of December.
I mean the most recent.
2 days ago, and today is my last one.
And by the way,
so 6 total.
She goes right from here down to the I was going to say what used to be called the pain factory is no longer called the pain factory. But and I think the reason why we try to do this, and we're so grateful that you could spend some time with us, is that everybody fits somewhere into this 6 stages. And it sounds like you're saying that Andrea is like a 3.
Right.
And I'm like a 5 or a 6. And so, but it gives you a level of comfort, don't you think?
Yes, for sure. Definitely.
Yeah, I think that's it. So, without getting you scared or anything, what's happening today? Is it today or tomorrow?
Well, kind of going back, Andrea had significant reflux in 2 of the more important superficial veins in each leg, the great saphenous and the small saphenous vein, and we did radio frequency ablation of both of those veins. And as well as what we call microphlebectomy to get rid of the varicose veins, and that's where we make just little needle puncture sites that typically heal very, very nicely. And through those puncture sites, we have special instruments that we extract the bulgy veins. So the bulgy veins are gone completely, and then we have treated the underlying problem, which was reflux in those saphenous veins. So after that, then we do an ultrasound, and some people, if they had reflux throughout the entire length of the great saphenous vein, sometimes that's the lower part of the vein is not a problem. It has stopped refluxing. But if we do, when we do our post-procedure ultrasound, if we see reflux has continued in that lower part of the vein, and if they are still having symptoms, then we often recommend that we go ahead and do a closure of that segment of the vein, the lower part, but we use a little different device because of the fact that there is a nerve that runs very, very close to the saphenous vein down around the ankle, and if we use that heat tip catheter, the radiofrequency catheter, sometimes it can bruise that vein, and people have either hypersensitivity or numbness, and that can last for a little while. So 2 days ago, on your right leg, we did something called Claravane, which is a little different device. It does not rely on heat to bring about closure of that vein. It does 2 things. We inject a medication through the catheter into the vein, which is a sclerosant-type medication. Same kind of medication that we use when we're doing injection sclerotherapy. And then also through the tip of that catheter, we can expose a tiny little wire, and that wire rotates, and it rotates at about 3,500 RPM. So it's really spinning. And
I was going to say that's more than a drill.
Very interesting process.
It's what that wire does is that it abrades essentially the inner lining of the vein, and that helps with the vein closing. So between the sclerosant medication and then this abrasion of the inner lining, the vein becomes inflamed, it collapses, and the walls stick together basically, and that's how it closes. So it's just another form of ablation, and typically we do that in one way or another on all the veins.
Okay, one thing before we run out of time here, Andrea. Were you ever worried, or did you have come up with a question that a lot of us do, and that is, if you keep removing all these veins, am I going to run out of them? I mean, what's going to happen here? You're going to take away this thing? What's going to be in place? I'm guessing that you did a fair bit of research, that you've really looked at this. Once you found out that you were a candidate, that you looked at the options?
Yes, I did look at the options, but when I was at the clinic, Dr. Rebecca also explained everything to me. So
So there weren't many surprises, hopefully.
Yes.
Yeah.
Yeah, and so that means, and obviously, maybe advice for somebody that's thinking about going in and looking at it. You got very, very proactive. You went out and found out. You found out about the clinic, found out about the procedures, and wondered, have you done so? Any regrets?
No.
Yeah.
All I can say is wonderful things.
Yeah, and that's the way we like it. Okay, so just so that we're going to do a follow-up with this later. What's the next procedure you're having?
Well, the same thing. The same thing. The same procedure that I just described on the right. Yeah, the other leg.
Yes.
So, and that'll be it. We'll be
now.
We'll be letting Andrea fly away. Yeah, but for now,
I'll be back.
Just for 6 months. Then you'll be flying back.
Well, it was certainly nice to meet you, and good luck on what's happening later on today. She's in a great attitude. She's going into the office right now to have a procedure. But she's laughing and having a good time. That's a good sign, right?
Yeah, sure.
They're encouraging me. So.
All right. Thanks very much. And don't forget, the rest of you, go to veinclinicsofhawaii.com, veinclinicsofhawaii.com, and check it out. See you next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.